It is 3 in the morning. You are sitting on the cold tile of your bathroom floor with that fluorescent light buzzing overhead like an angry insect. Your lower abdomen feels like someone parked a truck on it. You have tried everything you can think of. Extra water, walking the hallway, sitting on the toilet until your legs went numb. Nothing. Just this heavy, stuck pressure that keeps getting worse every time you push. If that sounds familiar, or if you are watching this for a parent, a spouse, or a dear friend who is too embarrassed to talk about it, I want you to stop what you are doing right now, take a slow, deep breath with me, and listen. You are not alone in this. This is not just being backed up. What you are dealing with is likely a fecal impaction, and if we do not approach it the right way, it can spiral into something serious, even dangerous. My name is Dr. Richard Miller. I've been a practicing physician for 16 years, and I've seen this exact situation more times than I can count, especially in folks over 60. Today, I am pulling back the curtain on this uncomfortable topic because too many good people suffer in silence, thinking it is just part of getting older. It does not have to be. In the next 25 minutes, I'm going to walk you through exactly why this happens, the warning signs you cannot ignore, what to do when you are stuck at home, when you need to get to the hospital, and most importantly, how to keep this from ever happening. Before we dive in, do me a quick favor. If you have ever struggled with your digestion, or if you are caring for someone you love, drop a comment below and tell me where you are watching from. Maybe you are in Florida, maybe Michigan, maybe sitting next to your mom in Arizona. Your stories matter. They help me shape these videos so they actually speak to what real people are going through. So go ahead, type a few words. I read every single one I can. Let us start with the most important distinction I make in my office every single week, the difference between ordinary constipation and a true fecal impaction. Most people treat them the same, and that is where things go wrong. Constipation is a slowdown. The gut is still trying to move things along, even if it is sluggish. An impaction is completely different. It is a mechanical blockage. Think of it like the main sewer line in an old house. If it is just a little slow, you might run some hot water and hope for the best. But once that line is packed solid with years of hardened debris, nothing is getting through. The stuff behind it starts to leak around the edges, but the main plug stays put. That is exactly what happens inside you. When stool sits in the colon too long, your body does what it is designed to do. It pulls every last drop of water out of that material. What starts as soft waste turns into something that feels like a brick. That rock-hard mass gets wedged in the rectum, and nothing can get around it. The liquid stool from higher up in the bowel seeps around the blockage, and suddenly you are leaking what looks like diarrhea. That is called overflow diarrhea, and it fools a lot of people, including some doctors who do not take a careful history. I will never forget a patient named Arthur. He was 74, proud German-Irish guy, retired machinist, the kind of man who did not complain. He came into my office looking pale and exhausted after 3 straight weeks of what he called terrible diarrhea. He had been taking Imodium like candy, thinking he had a stomach bug. He was getting weaker, more confused, and his wife was terrified. When I examined him, I found a rock-hard mass the size of a baseball sitting in his rectum. That watery leakage was not diarrhea at all. It was the body desperately trying to get rid of liquid that had nowhere else to go. Arthur looked at me with tears in his eyes and said, "Doc, I thought I was falling apart." That moment stuck with me because this is not rare. I see it every month. So why does this happen so often as we get older? It is not because you have suddenly become lazy or done something wrong. It is a perfect storm that builds over decades. First, our gut motility naturally slows down. The wave-like muscle contractions we call peristalsis lose some of their zip. What used to take the colon 24 to 36 hours can now take 4 or 5 days. That extra time gives the colon more opportunity to suck every bit of moisture out of the stool. Second, our sense of thirst changes. Many of my patients in their 70s and 80s tell me they simply do not feel thirsty anymore. Their body is drying out, but the signal never reaches their brain. And since the colon is basically a giant water reabsorption machine, that dehydration turns normal stool into concrete. Then come the medications. If you are over 65, there is a good chance you are taking at least one medicine that slows the gut down. Blood pressure medications like calcium channel blockers, diuretics, iron supplements, certain antidepressants, pain medications, antihistamines, even some drugs for overactive bladder. These medications are often life-saving. They protect your heart, your bones, your mood. But they come with this trade-off. I have this conversation with patients every single week. We are not going to stop necessary medicine, but we can manage the consequences if we are smart about it. There are other factors too. Reduced mobility, whether from arthritis, previous surgeries, or just the natural slowdown in activity. Changes in diet. Sometimes dental problems that make people avoid high-fiber foods. Even emotional stress. The gut and the brain talk to each other constantly. When someone is lonely or anxious, the intestines often pay the price. Let me give you another quick story. Margaret was 81, sharp as a tack, living independently. She came to me after her daughter insisted on the visit. Margaret had been having accidents in her underwear. She was mortified. She thought she was losing control of her bowels and was already looking at nursing homes. When I examined her, she had a massive impaction. Once we cleared it, the accident stopped immediately. She hugged me in the hallway 2 weeks later with tears running down her face. "I thought my life was over, Richard," she said. These moments are why I make these videos, because dignity matters at every age. Now let us talk about the warning signs you absolutely cannot brush off. If you are leaking watery stool but cannot pass anything solid, that is a major red flag. If you suddenly have new urinary problems, trouble starting your stream, feeling like you cannot fully empty your bladder, or getting up multiple times at night, think about your bowels. The rectum and bladder sit right next to each other. When the rectum is packed full, it presses on the bladder and the nerves. Many so-called bladder infections in older adults are actually bowel problems in disguise. Lower back pain that will not quit. It can be referred pain from the stretched rectum. Abdominal bloating that keeps getting worse. Nausea, loss of appetite. Even confusion or increased falls. The body is under stress, and in older adults, that stress often shows up first in the mind. Here is the timeline of how this gets dangerous, because knowing these stages can literally save your life or the life of someone you love. It begins with retention. Stool stays, hardens, becomes more difficult to pass. Then the colon gets distended. You start feeling full, bloated, maybe a little nauseated. If it continues, the pressure builds higher in the large intestine. Vomiting can start. This is when we move from uncomfortable to emergency. The real danger is when the bowel wall gets stretched so thin that it loses blood flow. That can lead to perforation, infection in the abdominal cavity called peritonitis, or even sepsis. These are life-threatening, so please hear me clearly. If you develop a hard, board-like belly, if you have fever, if you cannot pass gas at all, if the pain becomes severe, or if you or your loved one becomes suddenly confused or drowsy, stop everything and get to the emergency room. Do not wait until morning. Do not try one more laxative. This is not the time for home remedies. For those of you who are in the early stages and do not have those alarming symptoms, we can often handle this safely at home, but we have to be smart. The goal is softening and gentle removal, never force. First, stop straining. It is making everything worse. It spikes your blood pressure, strains your heart, and can cause hemorrhoids or painful fissures. Instead, get yourself a little footstool. Put your feet up so your knees are higher than your hips. This straightens the rectum and makes the exit path more natural. It is one of the simplest and most effective things you can do. Next, consider a glycerin suppository. Lubricate it well, insert it gently, and then be patient. These things often take 30 to 60 minutes to work. Do not keep adding more if nothing happens in 10 minutes. You will only cause cramping and irritation. Warm prune juice can help some people. A mixture of warm water, a little olive oil, and a touch of lemon sometimes works as a gentle enema, but only if you are comfortable doing it and have no signs of obstruction. The key word is gentle. I know many of you are wondering about manual disimpaction. The phrase itself sounds terrifying. Let me be honest with you. In the hospital, This is a common procedure. Trained nurses or doctors do it carefully, with plenty of lubrication and respect for your comfort. We monitor heart rate because stimulating the rectum can affect the vagus nerve and cause a temporary drop in pulse or blood pressure. That is why we do not recommend trying this at home unless you have been specifically trained and your doctor has told you it is safe. The most important thing I can tell you is this: do not feel ashamed. We see this every single day. It is a medical condition, not a moral failing. The nurses who help with this are kind, professional, and have seen it all before. You are not the first, and you will not be the last. Once the blockage is cleared, your body needs time to recover. The rectal tissues have been stretched and irritated. You will probably feel sore, almost like you did an intense workout down there. This is normal. Warm sitz baths are your best friend. Sit in a few inches of warm water for 15 minutes, 3 or 4 times a day. It relaxes the muscles, improves blood flow, and brings tremendous relief. For the first 48 hours, keep your diet very soft. Think oatmeal, mashed potatoes, scrambled eggs, bananas, cooked vegetables. Avoid raw salads and tough meats until things settle down. Hydration is critical. I want you sipping water or herbal tea all day long. Add a little electrolyte powder if you have been vomiting or had loose stool for days. Your body has been through a battle. Treat it kindly. Now let us talk about the part that actually excites me, because this is where we take control: prevention. If we do this part right, you can go years without another episode. The first step is having an honest conversation with your doctor about your medications. Bring your full list. Ask specifically which ones might be slowing your gut and whether there are alternatives or ways to add protective measures. Often, we can add a gentle osmotic softener like polyethylene glycol. It is not a stimulant. It simply pulls water into the bowel and keeps things soft. When used under medical supervision, it is safe and incredibly effective for older adults. Next, work with your body's natural rhythms. The gastrocolic reflex is strongest in the morning after breakfast. That is when your colon wants to move. Make it a habit to sit on the toilet for 10 to 15 minutes after your morning meal, even if you do not feel the urge at first. Bring a book, relax, let your body relearn the pattern. Consistency is everything. Movement matters more than you think. You do not need to run a marathon. A gentle walk around the block after dinner stimulates the gut. If walking is difficult, seated marches, ankle circles, or even rocking in a rocking chair can help. The intestines respond to physical motion. Give them some. Now let us talk about diet, because this is where I see the most confusion. Fiber is important, but it is not a magic bullet. If you suddenly add a lot of fiber to a dehydrated, sluggish colon, you are making things worse. It is like throwing sawdust into a clogged drain. Start slowly. Think about soluble fiber first. Oats, psyllium, beans, cooked fruits. And for every bit of fiber you add an extra glass of water. I tell my patients to aim for at least 8 to 10 cups of fluid a day. Coffee and tea count, but plain water is best. Some of my favorite preventive foods for older adults are stewed prunes, warm applesauce with cinnamon, chia seeds soaked overnight in almond milk, and good old-fashioned oatmeal with a pat of butter. Butter helps too. A little healthy fat lubricates the intestines. Pay attention to toileting position and timing. The modern toilet is actually not designed for optimal anatomy. That is why the footstool helps so much. Consider it part of your permanent bathroom setup. For those of you who are caregivers, you are the unsung heroes in this story. Your loved one may not want to talk about their bowels. They do not want to be a burden. So you have to watch for the clues. Are they eating less? Are they more irritable or confused than usual? Are they spending long periods in the bathroom with no results? Are their clothes fitting differently around the middle? These are all signs. Create a simple tracking system. It does not have to be fancy. Just a note on the calendar that says BM today or no BM. When you see 3 days without a movement, it is time to gently intervene with extra fluids, a stool softener, or a call to the doctor. Early action prevents emergency rooms and hospital stays. I cannot tell you how many hospitalizations I have prevented because a caring daughter or son noticed the pattern early. One more thing I want to say directly to the older adults watching this. Your body has carried you through decades. It has worked hard. Sometimes it needs a little extra help and understanding. There is no shame in that. The fact that you are watching this video tells me you are someone who takes responsibility for your health. That is something to be proud of. We have covered a lot of ground today. We have talked about the mechanical reality of impaction versus simple constipation. We have looked at how aging, medications, and dehydration team up to create problems. We have discussed the warning signs that should send you straight to medical care. We have gone over safe ways to handle it at home, what recovery looks like, and most importantly, the daily habits that can protect you for years to come. If this video helped you understand something new, please take 2 seconds and hit the like button. It tells YouTube that this message matters and helps it reach more people who are struggling in silence. If you have a question I did not answer, leave it in the comments. If you have a tip that has worked wonders for you or someone you love, share it. Some of the best ideas I have passed along to patients came from viewers just like you. Remember this, your digestive system is not your enemy. It is an old friend that has been with you every single day of your life. Sometimes it just needs the right support, the right rhythm, and a little patience. You now have the knowledge to give it exactly that. Take care of yourselves. Drink that extra glass of water today. Take that short walk. Sit on the toilet after breakfast tomorrow morning and give your body the time it deserves. These small, consistent acts are what keep us independent and comfortable as we age. Thank you for spending this time with me. I do not take it lightly. You could have watched anything today, but you chose to learn how to take better care of yourself and the people you love. That says a lot about you. This is Dr. Richard Miller. Stay consistent, stay curious, and I will see you in the next video. God bless you, take care, and remember, it is never too late to feel better.